Hello everyone, today we'll be learning about the Gemelli muscles. These are two small, paired muscles located deep in the gluteal region, right alongside the tendon of the obturator internus. Although they are small in size, their role in hip joint stability and movement is quite important. The word Gemelli comes from the Latin word meaning twins. There are two Gemelli muscles, the superior gemellus, and the inferior gemellus. They sit one above and one below the obturator internus tendon, almost like two little bodyguards. Because of their close association, the Gemelli, together with the obturator internus, are sometimes referred to as the triceps coxae. Let's look at where they come from and where they go. The superior gemellus originates from the ischial spine of the pelvis. The inferior gemellus originates from the ischial tuberosity, the bony part you sit on. Both muscles then join the tendon of the obturator internus and insert together on the medial surface of the greater trochanter of the femur. This shared insertion is what allows them to act in unison. Functionally, the Gemelli assist the obturator internus and the other small external rotators of the hip. Their main actions are lateral rotation of the thigh when the hip is extended, abduction of the thigh when the hip is flexed. Just as importantly, they help stabilize the head of the femur inside the acetabulum, which means they keep the hip joint secure and aligned during standing, walking, and more dynamic activities like running. Think of them as fine-tuners of hip stability, ensuring smooth and coordinated movements. Like many muscles of the gluteal region, the Gemelli receive their blood supply from branches of nearby arteries. The superior gemellus is supplied by the inferior gluteal artery. The inferior gemellus is supplied mainly by the medial circumflex femoral artery. This vascularization ensures that even though they are small, they have a reliable blood supply to function effectively. Here's something unique about the Gemelli. They do not share the same nerve. The superior gemellus is innervated by the nerve to obturator internus, roots L5 and S1. The inferior gemellus is innervated by the nerve to quadratus femoris, roots L4, L5, S1. This dual innervation highlights how closely these muscles are related to their neighboring structures. To summarize, the Gemelli are two twin-like muscles in the deep gluteal region. They originate from the ischial spine and ischial tuberosity, and insert with the obturator internus on the greater trochanter of the femur. Their key functions are lateral rotation, abduction inflection, and hip stabilization. They receive blood from the inferior gluteal artery and medial circumflex femoral artery. And they have different nerves. Superior gemellus via the nerve to obturator internus, inferior gemellus via the nerve to quadratus femoris. So even though these muscles are small and often overlooked, they play an essential role in maintaining hip stability and functional movement. Thanks for watching. If you found this video helpful, don't forget to like and subscribe for more content on anatomy and health. See you next time.